Obtaining a set of vitals is a basic skill that almost all healthcare professionals use. It can also be used by many, many other people who don't have medical training, but they can use it too in emergency situations. The first set of vital to talk about is temperature. Now, there are many different devices you can use to take a temperature, so it's best to obtain a thermometer, learn how to use that. There's so many different thermometers because there's many ways to take a temperature. There's the mouth, the ears, across the forehead, and rectally. Luckily, we don't do that one very often. The next vital to talk about is the pulse. There are several places on the body where you can obtain a pulse. There's the temporal, carotid, radial, apical, femoral, popliteal behind the knee, pedal, and posteriotibial on the foot. The most common pulse site to take is on the radial pulse, which is down the thumb. Use 2 fingers, press around until you find it. You may have to press around a little bit depending on the strength of the pulse. Once you find it, count the number of beats for 1 full minute. A normal pulse is 60 to 100 beats per minute. The next vital sign to talk about is respirations. Respirations can be a little bit more difficult. To count respirations, look at a person and watch their chest and stomach for movement. Now, if you tell a person you're taking their respirations, this may cause their respirations to change. So, a good way to do that is to continue feeling the pulse after you've taken it. That way, they don't realize you're taking their respirations. Again, count the respirations for 1 full minute. A normal respiratory rate is 12 to 20 per minute. If it becomes difficult to see, you may have to place your hand over the patient's chest or abdomen to feel. If it's still too hard to feel after that, you may have to use a stethoscope. And you just place the stethoscope over one of the lung fields to hear. However, then a patient knows that you're taking their respirations. The next set of vitals to talk about is a blood pressure. This vital sign is probably the most difficult to take, and it does require some equipment, a stethoscope and a sphygmomanometer. To take this vital sign, put the stethoscope around your neck, wrap the blood pressure cuff or the sphygmomanometer around the person's arm. Have them keep their arms straight. Now, this part is sometimes left out. You can try to find the brachial artery. This is sometimes left out because it can be hard to find, and because palpating this artery can slightly change the blood pressure values. The other thing to remember with blood pressure is to choose the correct cuff size. A cuff size too big or too small will give an inaccurate reading. Put the earpieces of your stethoscope into your ears and place the bell of the stethoscope over the brachial artery. Inflate the stethoscope to at least 160, and then slowly deflate at about 2 to 3 millimeters of mercury per second. That's the measurement on the sphygmomanometer. When you first start hearing a thumping sound, that is the systolic blood pressure. When you can no longer hear the thumping sound, that is the diastolic blood pressure. You may have to listen several times to hear it. It takes practice. It can be difficult. A normal blood pressure is 120/80. Now keep in mind that the numbers I've given you for vitals are for an adult at rest. They may be changed depending on different variables and the person's overall health. The best way to become good at vitals is to practice. And so practice, and you will become very excellent at using this useful skill.